Assalamu alaikum. I am Abdullah from Group C1. My registration number is 2021 DVM 169. Today I am going to discuss with you a case study on the topic of fetal mummification in a goat. This article is taken from a journal Clinical Theriogenology 2023 written by Elizabeth Witt. Basically, fetal mummification occurs when a fetus dies inside the uterus of a mother. It mostly occurs when a fetus dies during second or last trimester of the pregnancy. The fetus does not undergo autolysis or expulsion from the uterus, and this condition occurs rarely in goats. So, if we talk about case presentation, a 5 years old goat was presented at a clinic 1 month after expected kidding date. The goat showed signs of vaginal discharge and fetal membranes were visible from vulva. On the other hand, the goat was bright, alert, and active, but heart rate and respiration rate were elevated. On physical examination, it was observed that the cervix was closed and hardening of uterus was observed. Diagnosis was confirmed by ultrasound. Ultrasound was performed by both approaches, transabdominal and transrectal. On transabdominal ultrasound, it was observed that uterus was irregular and there was no fetus visible. But on the other hand, when transrectal ultrasound was performed, a small bony fetus was observed and there was no fremitus. So ultrasound made it clear whether it is a case of mummification or maceration. In this case, as we saw in physical examination, that cervix was closed and there were no signs of any bacterial infection or pus in the uterus. So it was confirmed that it is the case of fetal mummification. So if we talk about the treatment, case of fetal mummification can be solved by two approaches. First approach should be hormonal. In this approach, we inject prostaglandins and then oxytocin. Prostaglandin causes luteolysis and oxytocin causes opening of the cervix, and this ultimately results in expulsion of the fetus from uterus. But in second approach, surgical removal of the fetus is done. In this case, left flank C-section was done and fetus was removed. For the post-operative care, NSAIDs and antibiotics therapy was done, and owner was advised to keep the goat in clean place to avoid any secondary bacterial infection. After C-section, the goat was observed under critical care. Thankfully, the goat recovered and discharged next day. The owner was advised to check for the appetite, feces and signs of infection, and if any infection occurs, consult the doctor immediately. Fetal mummification occurs mostly in Politococcus species. Politococcus species are the species which give birth to multiple fetuses. It occurs rarely in goats, but infectious agents like Toxoplasma, Chlamydophila and Coxella may cause fetal mummification. There may be some involvement of genetic factors. Uterine torsion is the major factor which causes fetal mummification in many species. So if we talk about the management, always keep in mind that mummification does not damage uterus like maceration. In case of maceration, there is a bacterial infection and pus formation inside the uterus which damages the uterus severely. But in case of mummification, there is no bacterial infection, and when the fetus is removed, the uterus returns to its normal condition, and the future fertility of the animal depends upon the cause and severity of the case. So we have got some learning points from this case study. We learned that fetal mummification is rare in goats and there is no certain etiology. Secondly, a prostaglandin therapy does not always work, and in case when the prostaglandins therapy does not work, we have to opt for the surgical procedure, C-section. And thirdly, if we diagnose the case at early stage, the prognosis is good and we can save the animal and its future fertility. Thank you.